this beautiful August gathering. Good morning to everybody. Dr. Preeta Reddy, Dr. Sangeeta Reddy, Dr. N.D. Trivedi, and my colleague, Secretary, Dr. Pradeep Vyasji, the delegates from the 30 different international areas, more than 2,000 participants in this conference. So I congratulate Apollo Hospital for their elaborative conference, seventh international conference, which is, the subject of this conference is close to our heart. So thank you very much for contributing in the health services and healthcare. I have seen all your conferences which are shown on the screen. So really the patient safety for us is a matter which is most important, close to our heart. And in day-to-day life, the people grumble about the treating the patient. In the big hospital, rightly, Reddy Madam has said about the affordability. You talk about 3 A's. The one of the A is affordability. And the affordability is a criteria which is concerned to all the common person and the common patient. People wants everything in free, and that is government is doing around the 6 crores patients are treated in the government hospital every year. But there is a private setup. We are not in the tertiary care, Dr. Pradeep Vyas has rightly said. But we try to go to the trauma care. We try to go to the SNCUs, NICUs, and try to treat the patient which are in the tertiary stages. At the same time, the hospital infection is a most important part of our treatment part, because many of the patients, they get the hospital infection after staying there for a long days. Recently at Hinduja, we have come out with one book, manual, SOPs for how the ICCUs and ICUs should be. What is level 1 ICU, what is level 2, what is level 3. So that is again my brainchild. I requested Hinduja Hospital to come out with such kind of manuals, so it will be useful for us to give the patient a more safety and more correct view of the ICU. Today in Times of India also somebody has mentioned about the ICU standard. So now this subject is coming up very fast. And as Dr. Pradeep Vyas has said, that NABH accreditation regarding all the hospitals, whatever we empaneled for our schemes, these hospitals are the NABH standard. But frankly speaking, I don't criticize anything, but frankly speaking, the NABH standardization has got a lot of clerical work rather than the practical work. Because there are so many papers you have to show to the NABH. So many cases, so many reports. I think there is a smile on the... So there are a lot of clerical work, I will say, because the hospitals are for the practical purposes. We are treating the patient, we are saving the lives. And people don't write the case histories and all these things so meticulously. So I will request that if NABH people are there, I have also requested them officially, that you should cut down the clerical work, you should cut down the histories, don't go into the histories, come to the practical point of view and accredit the hospitals for the NABH standard. They should not mind. At the same time, regarding the hospital infection and other things, patient affordability, so nobody has thought about the infection coming from the ventilators. We always prefer that we should have all the disposables for the ventilators. But when we saw the swine flu cases, majority in the state of Maharashtra, the ventilator-acquired infection is also there. AC-acquired infection is also there. That has worsened the patient. So this is a practical view. So there should be a SOP, standard protocol system, for how to use the ventilator, how to clean the ventilators, and how to keep the ventilators in the proper form. So these are the basic things. I think this should be contributed to today's conference. Second thing is that when we are in the OTs, we always prefer to have a steel OTs. But the smallest crack, smallest abrasion on the OT wall while taking patient on the stretcher inside, that can also contribute to the bacterial growth. Because we are not noticing that all the joints which should be filled by the silicone are intact or not. After the few years, after the 2-3 years, the accumulation of the bacterial growth is always there. So there should be some solution to these cracks and all these things. So these are the 2-3 points which I wanted to mention in front of you. You will be more elaborative on this patient safety norms. When the patient walks inside the hospital, he should be treated properly. Every time the complaint is about the patient safety, that the patient comes, this is a common thing, this is not related to, but since you are the hospital owner and you are associated with the hospital part of the state, always it is asked that deposit the amount. And patients' relatives get wild on you. And then the conflict starts. So try to get the patient inside. And there should be the person who is handling this type of cases at the desk, at your desk, should be a little bit polite, little bit understanding. That patient is in agony, we should not add to his agony. See, the money has to be paid because you have to run your business. Hospital is an industry, so I don't mind asking for the money. But whenever the patient will be there, please take it little bit cautiously. So the other conflicts, the vandalizing of the hospitals and the other things may not happen in future also. So there should be a training program for this also, how to talk to the patient, how to react to the emotions, how to handle the patient's relatives. There are the conferences. This is the 7th conference. I will request Dr. Preetha Reddy and Sangeeta Reddy that whatever outcome will be there from these conferences, whatever you gather from the brainstorming session of these days, conference day, so please share with us. So whatever the best you found out from this conference, please share with us. It will be helpful for us also. Regarding PPP model, Dr. Pradeep has already said that we are ready for the PPP projects. We need to give all our trauma care centers on the PPP basis so that we can have a better things, as well as the NICUs, which we are going to promote in near future. So if anybody is interested, please come out with their proposal and contribute to the health. And it is a great slogan that join your hands for the patient safety. Government is with you, you are with us, so let us do for the patient's benefit. Thank you very much.